Good morning. As you noticed, we're a little bit late, but we did have some technical issues. There we go. So welcome to NAMI Maine's virtual walk, which hopefully will be in person next time. And we want to just take a few minutes to thank you for watching our video. We have some great clips we want to share with you and really honor the folks that are committed to raising awareness about mental health and to being advocates on this issue. So we want to thank our sponsors, Anthem, Northeast Bank, Kennebec Behavioral Health, Norman Hanson and DeTroy, Maine Behavioral Health Care, First National Bank, WMPG, Cross Insurance, Martins Point Healthcare, MaineGeneral, Healey Associates, and Catholic Charities. We really want to thank all of them for their support of mental health and the work of NAMI Maine across the state. Really important from our perspective that you hear from different voices about mental health. Our goal is to provide support, education, and advocacy to individuals and families impacted by mental illness all across the state of Maine, and to provide suicide prevention supports and post-vention supports in communities in order to decrease the number of Mainers who die by suicide and support Maine families. So we're going to hear from the clubhouses, from one of our clubhouses, a great advocate. The clubhouses show up every year in really big numbers at the NAMI Maine Walk. So it's very fitting that they're the first speakers we hear from.
I walk for mental health awareness.
I walk for a better future.
For a brighter tomorrow.
I walk for exercise and social interaction.
I walk for those who feel like they don't have a voice.
I walk for my future recovery.
I walk for my parents.
For my sister. For my mom.
I walk for veterans.
I walk for myself.
I walk because I'm not alone.
I walk because I believe in change.
I walk to break stereotypes.
Because I'm not a danger.
I am not crazy.
I'm not weak.
I am not broken.
I walk because my mental health matters.
I walk for a stigma-free Maine.
Clubhouses, just so everyone knows, their mission is to improve the quality of life for adults who experience mental illness by providing social, educational, and employment opportunities. We really want to thank the Capitol Area Clubhouse for putting together that awesome video. I thank all the clubhouses for the work they do.
My name is AJ Mendez, and I am a proud mental health advocate. Mental health matters to me because I live with bipolar disorder. It's important to share my story of surviving and thriving with mental illness in order to shatter the stigma surrounding the topic, ease some of the fear of the unknown, and help people feel less alone in their fight, especially the people of my community. I'm Puerto Rican, and I have experienced firsthand how cultural barriers can prevent people of color from getting treatment. In my own family, after struggling with poverty and homelessness, strength was synonymous with silence. Survival was top priority, and mental health treatment was seen as a selfish luxury rather than a necessity. For Latinx, Black, Indigenous, and Asian communities, there are many other barriers to treatment. There is a lack of access to quality mental health services or coverage, a lack of non-English speaking or culturally informed providers, and a medical system that too often overlooks and fails Black and Brown health. In a world where a social movement for equality and safety is being met with pushback and hatred, it is more important than ever to prioritize our emotional well-being and protect our mental health. I am a proud mental health advocate because I believe the key to shattering stigma is education and empathy. Mental illness is not rare. 1 in 4 adult Americans live with it. Mental health is inextricably tied to physical health. And asking for help and seeking treatment is true strength. You are worth protecting. Mental health matters to me because mental health matters.
Just want to thank AJ again for sending us that video. If you happen to have missed her at our conference before, she was an outstanding speaker, has a book called Crazy is My Superpower. And every time I watch that, she gives me goosebumps. She's a great advocate nationwide for mental health. And that advocacy work is so important, whether it's person to person with a school district or with an employer, or whether it's in the State House trying to make change. Advocacy is a big part of what we do at NAMI Maine, and we really appreciate your support to strengthen our advocacy work, whether that means you donate to NAMI Maine or you come testify with large groups, or whether you come testify by yourself, or whether you write letters to your state representatives when we send out our call for action because you're a member. Because if you're a member, you'll get our call for action when legislation is moving that matters to us. So advocacy matters to all of us, and it happens in so many ways, and AJ is a great example of an advocate.
Tim Sample here, winner of the Tim Sample Look-alike Contest 3 years running at the Freiburg Fair. And I'm speaking to you regarding the 2020 NAMI Walk on the Capitol. And of course, like everything in 2020, it's a walk, but is it a real walk, or is it a virtual walk, or what are we actually doing? There's a big, steep learning curve for this whole year, but I am here to say that I am a tremendous supporter of NAMI Maine. I have received insights and help and support in ways that I don't think I could have possibly gotten from any other source. I found out about NAMI Maine almost 20 years ago when a close family member was diagnosed with a very serious mental illness, and I joined up for the family-to-family course, and it was 12 weeks of very intensive and very helpful connection with other people struggling with the same issues that I was struggling with, how to be a supportive family member. And there's not a lot of humor in some of this stuff, but I found a little. For one thing, I came away with a really interesting line that I've used many, many years since those early days with NAMI, and that is that when it comes to dealing with mental illness and its ramifications for the family, sometimes my idea of a good idea is a bad idea. And what I mean by that is the best intentions may be counterproductive. And that's where the professional mental health professionals, family members that have tried different things, is a wonderful pool of information from folks who have experience in this very challenging area. And the other thing, another line that I remember from early days was, if someone is drowning and you can't swim, don't jump in after them. Now, that doesn't mean you can't throw them a life preserver or call the Coast Guard, but be aware of your need to stay healthy and solid yourself if you're going to be helpful. So with that in mind, I want to encourage everybody to utilize the resources of NAMI Maine and support NAMI Maine in this year's rather unconventional walk on the Capitol. And in the meantime, stay safe and have a good laugh every time you get a chance to.
We just want to say thank you again to Tim Sample for giving us this clip. He has spoken in person at our walks before. And he talks about the core NAMI services. It's important to NAMI that folks realize that we are a collection of local affiliates. We have 7 local affiliates across the state that really work to improve services, to provide family-to-family and support groups, as Tim had mentioned. And these affiliates really serve as the heart and soul of NAMI. There's a group of wonderful staff here in Hallowell, but our volunteers who donate countless hours to supporting other families are a critical aspect and really the cornerstone of who NAMI is as an entity. So please reach out to your local advocate, your local affiliate, become an advocate, get connected to NAMI. Family to family is what you heard Tim Sample mention. It used to be 12 weeks, it's now 8 weeks. We are doing this virtually, so if you are a family member or a close friend of a person living with a mental illness and you'd like to participate in a virtual family to family class, please reach out to us, 622-5767, or our website. You can find out when the next virtual family to family class is happening. We do work to have them happen every year, usually all around the state, now virtually. Support groups is another core aspect of what NAMI Maine does in local communities. We find volunteers with lived experience as family members or as a peer, person living with a mental illness. We provide them with a support group facilitator training, and then they facilitate support groups in their local community. We have a list of those on our website. These are also happening virtually. So support is still here for you during these challenging times. And remember that that person-to-person connection cannot be, cannot really be minimized. It is so important.
I was asked why my mental health matters to me. And the first thing that came to my mind was, well, why does my physical health matter to me? And my physical health matters to me because I want to be healthy, I want to live, and I don't want to be sick. And that same thing applies to my mental health because they're one and the same. And I wouldn't be in the place that I am today if it wasn't for my parents. I was diagnosed with bipolar disorder when I was 13 years old. And when my mother first talked to me about going to therapy or other treatment options, the first thing that came to mind to me was, well, that's for crazy people. I don't want to go to therapy. I don't want to go to a psychiatrist because I'm only 13 years old and I shouldn't have to do that. And I began to realize that there were certain things that I needed to do to take care of myself. And going to therapy and going to psychiatrist was normal and it was helpful to me. And honestly, it saved my life. And I've been to the mental hospital and it was great for me. And it's what I needed at that time. And that's how I took care of myself. And that's something that a lot of people who are 13 and they're diagnosed, I think they don't realize, is that going to therapy isn't for spoiled rich kids in movies. And you don't have to have even a mental diagnosis or a reason to go to therapy. It's just good to take care of yourself. And for some people that's therapy, and for some people it's taking a walk with their dog. And I think it's really important to focus on those little things that we do, like washing our face, petting our animals, putting on sweatpants and fuzzy socks, because all those things make me feel good. And that's how I take care of myself. And I'm just so happy that I had the parents that I had, because they reached out for me. They got me to those support systems that I needed to go to. And I work for the NAMI Maine teen text line. And for a lot of teenagers who don't have those resources, that is a place that you can text in. And we will help you as best as we can and give you resources, because I understand that resources aren't always available to people and you don't know where to go to find it. And sometimes you just need someone to talk to about your problems that's going to listen. And that line is a great resource for that. And I wish that I had something like that when I was younger. And just overall, my mental health matters to me because I want to live, I want to be happy, and I want to smile every day and know that sometimes it's okay to not feel good and to not feel okay. But you just have to do the things that make you happy. And honestly, that's what really matters.
So I want to thank Kassidy, who is under 20, for her bravery and willingness to be a mental health advocate and to work on our teen text line. And she really highlights an important point for all of us, which is that 75% of mental illnesses present before the age of 24. So the sooner we can identify that a young person is experiencing a struggle, the emergence of a mental health condition, and the sooner we can connect them to help, the more able they'll be to learn to understand their unique challenges, just like with physical health, and learn the skills and tools and resources to support their mental well-being. Nationwide, we lose more 10 to 14-year-olds to suicide than traffic fatalities nationwide. So we really need to pay attention to our young people's mental health and a diversity of ways that connects to them. So back in April, NAMI Maine launched our teen text line. As you heard, Kassidy is one of the folks under the age of 24 who staff the teen text line. Please share this information with any young person that you can think of. It's designed to work for young people between the ages of 14 and 20, and really open from noon to 10 p.m. 7 days a week. In addition to that, we also have started recently, thanks to 2 outstanding volunteers, a Young Adult Connections recovery support group for young adults between the ages of 16 and 24. It's a Zoom support group designed to provide peer support and in a really dynamic way, but with two outstanding young folks, young adults who have come together to facilitate the support group. I think it's important we recognize that mental health is incredibly personal. So what works for one person may not work for another. And our goal at NAMI Maine is to find everybody's yellow brick road, whether that's meditation and, yoga and eating a plant-based diet, or whether that's a therapist and a psychiatrist and medication or some combination of all of that. We believe that mental health is incredibly personal and that folks should have every option available to them. And we also realize the importance of connecting to other people with similar lived experience. So our goal here is really to ensure that we have as many resources in the state of Maine as possible and that we can help facilitate. I always describe NAMI Maine as the grout between the tile that helps people find what they need and fills in the gaps and provides those gaps so that they are able to live the lives that they envision for themselves.
Hey everybody, my name is Jared Mills and I'm the police chief here in our capital city in Maine, Augusta. And I want to take a few moments to talk to you about why mental health means so much to me. To start with, it affects everybody. That's why it's most important. You talk about your personal life. Our mental health affects how we cope with life. Lack of treatment leads to hopelessness, sadness, worthlessness, feelings of guilt, anxiety, you name it. It's very, very important that we have that treatment and have those lifelines to reach out to in order to help us along, both personally and professionally. Obviously, with the police department and our calls for service and what we deal with on a daily basis, it is very, very important that we have those connections with the mental health system and our service providers. We get these calls where most often the first responders to somebody in a mental health crisis or in need, whether that be a large or small situation. And we can't do this alone. It's very, very important that we have places like NAMI Maine, crisis and counseling, our hospitals to be able to collaborate with in order to take care of the folks that need help at their time of need. And we're not all exempt, or excuse me, not everybody's exempt. Police officers are very, very important. The part of this equation, both in helping and in times that we need help. Officer resiliency. We have a mental health worker that rides with our police department in the cruises with the officers. And not only does he help the public, but he helps the officers as well, because we are consumers and we are in need of mental health assistance as well at times. So you name it, it's in every facet of our life, and not only personally and professionally, but it's very, very important that we have assistance with this and our collaboration. So it's great talking to you. Thank you for giving me the time to speak about the importance of the mental health system and why mental health is so important. Thanks and have a great day.
So we want to thank the Augusta Police Chief, Jared Mills, for that clip. And we want to talk for a minute here about CIT. I think it's really important right now in this nation to talk about CIT. We talk about systemic racism and what we can do to promote change. And there's a lot that can happen around systemic racism. And people ask me, why do we work so closely with law enforcement? Because that's what Crisis Intervention Team program is about. It is not a training, it is a program. We started by NAMI Memphis after a Black man with mental illness was shot and killed by law enforcement. And they said, what are we gonna do differently? And really NAMI was a core partner. And as NAMI National will tell you, NAMI was a core partner as an accountability partner, because we have mental health, law enforcement, NAMI, and with NAMI comes peers and families. And our goal is really to implement a community policing model that changes the way that law enforcement responds to people in a mental health crisis with a mental illness or suicidal thoughts. But it's not, while that's the focus of CIT, it's really about community policing. And community policing is a different approach to policing, where it is really connecting, working with, not over your communities from a law enforcement perspective. There's kind of the command and control orientation to policing, which we've seen too often lately in national tragedies where that can lead to. And then there's community policing. We have some great folks in the state from from Chief Mills to Sheriff Troy Morton, who work collectively with their communities and hold their role and work in partnership. And so CIT is really a system change model. It's really a model of making profound change in the way that law enforcement responds. And quite frankly, it's not easy as a NAMI to hold that role of the accountability partner, but we believe that we need to address systemic racism. We believe we need to ensure that community policing responses are what our families and peers receive when our loved ones are struggling. And we have been implementing and coordinating CIT in the state of Maine. We were the first New England state to bring the CIT program to New England since 2003, when Melissa Gatine, we call her the godmother of CIT in Maine, but when she went down to Memphis and brought the program to Maine. So we are very proud of our CIT work and really view it as a system change model that we welcome folks to engage with us who are interested in helping us to promote community policing and really change the way that law enforcement responds to people in a mental health crisis. And we have about 56, 57 of our law enforcement departments in the state of Maine have signed the participation agreement. If you want to know if your department has signed, meaning they agree to implement the program with fidelity to the model in true partnership, you can look at our website, because we have listed the departments that have signed the agreement that are working with us to implement CIT. So if they say they implement CIT and they're not on our website, they don't implement CIT.
A virtual walk, but a walk nonetheless. The spirit is there, the intent is there, the work is there, the concentration on one of the most important issues facing us right now is there with you today. I'm really glad to be able to join you. I believe that this country is suffering from more than one pandemic. Of course, we all know about the coronavirus, but we also have an underlying mental health pandemic. We have an epidemic of suicide, of depression, of drug abuse, and we have the means to deal with it, but I'm not sure we have the will. I want to thank the Alliance for all the work that you do in Maine and across the country, not only to bring attention to this incredible need, but also to work on solutions. I'm working on some solutions at my end in Washington, making telehealth more available, working with CMS on telehealth and telephone health. Any kind of opportunity that we can have for people to reach out and to be reached is very important and good for the country. 988, I think, is a step forward. So there's a lot going on. And let me share with you one of my special priorities. It turns out that the budget of the National Institute of Mental Health is something like 3 or 4% of the budget of the National Institutes of Health. In other words, we're spending 30 times on physical illnesses research what we are on mental health research. I think that has to change. I've enlisted some allies in the Senate to work on this, and that's going to be a project that I'm going to be following up on in Washington, not only this fall, but throughout as long as I'm in the Senate and have the opportunity to work on these issues. But mostly today, I just want to offer encouragement and thanks for the work that you're doing for Maine, for your community, and for our country. Thanks, congratulations, and please keep it up.
We really appreciate the work that Senator King does. We really appreciate his willingness to highlight the importance of mental health and to show us solid leadership on advancing issues that do impact our community. We worked, NAMI Nationals worked on the national level to try to address the need for more crisis mental health dollars in our state, really in every state across the country. But that's an important issue that should you talk to any member of our federal delegation, highlighting the need for more mental health resources, dollars for more community-based mobile crisis response is one of our top priorities. So I want to take a minute and just acknowledge those folks who raised money for us, even under these unique and challenging circumstances. So when we talk about the top team fundraising. So there is the boardwalk that raised the most amount of money. I do just need to pause for a minute and acknowledge that there are some amazing families that do their own events that raise money for us, and do their own walks that raise money for us. And we are so grateful for them and their local efforts to raise awareness that they do, then donate funds to NAMI Maine. In terms of this virtual walk platform, the boardwalk, which is NAMI Maine's board, did raise the most amount of money. And second was Tony's Trekkers, which is the NAMI Bangor team. And we want to really acknowledge the work that they did to raise funds as well. Knowing that when people donate to their local affiliates team, those dollars, do benefit their local affiliate. So the largest team goes to the Capitol Clubhouse. Not surprising, because clubhouses always show up, and we are very much appreciative. The second largest team is the board team. But we once again really hope that the Capitol Clubhouse and all the clubhouses will come out in mass again for us when we're back in person. In terms of top donor, Mike Pooler is an individual who donated the most single donation to the virtual walk, with Bob Reed and Sarah and Tony Everdale being our runner-ups for that, donating the largest single donation. So we want to thank them as well for helping us raise funds with this virtual walk, because we know that this platform is challenging, and we recognize, that we have raised with our walkers and our walk teams just a few $100s short of $20,000, and with our 12 sponsors, almost $10,000. So we're just shy of raising $30,000 for this event. We hope that folks will consider donating today, donating to support NAMI Maine, recognizing that we hold a unique role, which is to provide the support, the education, the advocacy. Our helpline, that 622-5767 number, is a number designed to help people navigate the system, figure out where they can access care. We provide no clinical services, so I refer to us as Switzerland. We'll help you or your loved one find what works for them. And we really appreciate folks sticking with us. We appreciate you sticking with us with our technical challenges this morning to make this event happen, although very much smaller than normal. But we do really want to acknowledge all of the folks that were willing to send us clips, elevate the issue of mental health, and walk with us in this work, even if not in person together.
Hi, I'm Denise McDonough, President of Anthem Blue Cross and Blue Shield in Maine. I hope that you and your families are all staying safe and healthy. Anthem is committed to improving lives and communities, and that's why we're so proud to support NAMI's mission and sponsor this year's NAMI Maine Walks on the Capitol. Thank you for joining us today. Although this year's walk is a little different, its core purpose remains the same: to provide support and hope to people living with mental health conditions and substance use disorders. Taking care of our mental health is just as important as taking care of our physical health. And right now, because of the need for continued physical distancing, many may be experiencing feelings of loneliness, anxiety, or isolation. In fact, nearly half of American adults report that the COVID-19 crisis has affected their mental health in some way. In these tough times, when we can't embrace some of our loved ones or be with them in person, it's important to remember that we're not alone. We must support one another, take some time for ourselves to practice self-care, and be sure to seek help if needed. Challenging times like this remind us of why NAMI's work to provide education, support groups, resources, and advocacy for thousands of Mainers living with mental health conditions is so vital. Your support and participation today help NAMI continue this critical mission across the state. From all of us at Anthem, thank you for all that you are doing to raise awareness of mental health issues and to strengthen the well-being of our communities.
We just want to thank Anthem again for being our largest sponsor of this year's virtual walk. We also want to make sure that you all know that on Thursday, October 1st, we will have a virtual conference. And it is this year's Beyond the Basics conference. It's the conference that the Maine CDC contracts us to organize with them every year. And we hope that you will consider attending the virtual conference and gaining some more skills and helping us to prevent suicide, because suicide is preventable and we all have a role in that. But unfortunately, there's really not a lot of places that help us, teach us what that role can be or how to even recognize warning signs. And that's a big part of what we do at NAMI Maine, and it's a big part of what the Beyond the Basics conference does. So hopefully you'll consider attending the Beyond the Basics conference this year. We really want to thank you. We want to thank you for taking time to watch this. Want to thank you for your ongoing support. You know, we are a community. We are not just an entity of people, families, and peers and professionals who are committed to the issue of mental health, who believe that finding support, getting education, finding connection and community is what makes us whole, what makes us thrive, and what really makes us function well as part of a community. You know, the greatest cost to the economy, the greatest cost to the worldwide economy is depression. So we must come together, get kids help younger, find different options for people so that we recognize that mental health is incredibly personal and what works for people is personal, and support the uniqueness of each one of our journeys. So I appreciate your support of NAMI Maine. I encourage you to check out our new website. I encourage you to get connected to our affiliates. I hope you'll come to our next in-person walk where we'll dance and have a great time. And I appreciate the time you spent watching our virtual presentation today, because mental health matters to all of us, and we know that mental health matters to all of you. So please reach out, be connected to us and to one another, and know we are here to help you in whatever way that we possibly can.